Validating the functionality of a ventricular peritoneal shunt in adult patients involves a holistic approach that encompasses clinical assessment, imaging studies, and on occasion, specialized diagnostic tests. To determine if a shunt is working, several methods can be employed. Firstly, monitoring a patient's symptoms can indicate a shunt problem, with signs of a malfunction including seizures, headaches, lethargy, vomiting, confusion, irritability, dizziness, and photophobia. A shunt patency study, or shuntogram, can also be conducted to verify the effective flow of cerebrospinal fluid through the shunt system, which involves introducing a small quantity of a radiotracer into the shunt reservoir to quantify CSF flow through the catheters and valve. Imaging techniques such as CT or computed tomography scans can provide detailed images of the brain and help identify problems like shunt blockages or malpositioning. MRI or magnetic resonance imaging scans can provide more detailed images than CT scans and are often used to evaluate the brain and the positioning of the shunt. A series of X-rays, known as a shunt series, can also be performed to assess the placement and integrity of the shunt components, including the tubing and valve. Although this method does not provide information about CSF fluid flow through the shunt system, in some situations, a lumbar puncture or spinal tap may be performed to measure cerebrospinal fluid pressure and characteristics, as abnormal CSF pressure or composition can be indicative of shunt dysfunction. The frequency of ventriculoperitoneal shunt evaluations is subject to variation, influenced by factors such as the patient's medical history, the indication for the shunt, and the potential presence of symptoms or complications. Routine follow-ups and examinations are necessary to oversee the shunt's operation and confirm its correct functioning, with close monitoring particularly necessary after the initial placement of a VP shunt. By using these methods, healthcare professionals can determine if a VP shunt is working effectively in adult patients.